the healthcare team understands that it is a difficult decision to prepare for dialysis, especially when the patient is feeling well, they're not feeling sick, they're eating, they're exercising, and they're following the recommended health plan. It's important because the patient needs to decide on the kind of dialysis they want. They need to know their options of the types of treatments that are available, which one is going to fit into their lifestyle and help them to stay healthy for as long as possible. So the team, consisting of doctors, nurses, other healthcare professionals, will provide them with information about the different treatment options. So they'll talk about kidney transplant, they'll talk about doing dialysis at home, coming to the hospital to have dialysis treatment, or the option of doing no dialysis.
Being ill and being so sick, you lose control of so many things in your life. So the things that you can maintain control of is very important. It was important to me to have that control, and home dialysis gives me that control.
If I changed from hospital to home, so the benefit is I now need to drive back, so drive during the nighttime, you feel really lonely, you feel really sad. So and now if you're at home, so that means all the people, all the family people around you, the only thing you just sitting there or lying down there, so just you can talking to the family, you can watch TV, and also it's still like family. The only thing is you have to stay there for 3 or 4 hours. But nothing changed, looks like nothing changed.
Because I never really listened to the doctor when he was talking to me. I didn't know, they put me on hemo, but for 6 months I did hemo. But I knew I couldn't do that forever, right? So I was on hemo, and during that period of time, that's when I started to listen, and I asked, what other means of dialysis are there? And then, this hospital explained all of them, and then eventually I decided to go on peritoneal dialysis. It was better in terms of being able to still continue what I'm doing. Like I was still able to, attend my older kids, extracurricular activities, whatever he had to do. Still go to work.
I chose PD because I used to be very active and spontaneous. I was able to do a lot of things that I wanted to do. So PD gives me a chance to retain some of that, the flexibility of it.
It was my aunt. My aunt's the one that volunteered to get her. Well, my whole family did, but she's the only one that was necessarily compatible to me. And originally I chose to have it from a cadaver because I didn't want to inconvenience my whole family, even though they were willing to, donate their organ. But after a year and a half, or I think a year being on dialysis, I was able to deal with that dialysis part of it. But again, that my life is, and everyone else's life, is busy, right? So, I put that on the table to my family and said, I'll accept a kidney because they're all offering, their kidneys. So, and then after, I think a year and a half or 2 years, everything was ready to go, and I got my kidney transplant.